Chapter 15. Stress Management for Nurses. Many factors can contribute to effective stress management for nurses. One of these factors is the role of friends and family members. In order to overcome stress, nurses should have the support of superiors, family members, and friends. An effective context for support can be created by authorities, such as providing adequate equipment, positive feedback, and continuing educational workshops. Additionally, effective communication skills and access to counselors can also aid in stress management. Positive outcomes of stress management include an understanding of the meaning of life and personal growth. Relaxation stations. Students learn how to cope with stress and use useful strategies in a classroom center setting by using a relaxation station. Students learn to practice stress management skills and personal health habits, which they later use in the workplace. They also learn how to set up a relaxation station, complete with supplies and a rubric. Students use the stations as a form of personal stress relief, communicating the strategies they are using to their peers or an adult. Researchers at UCF have found that relaxing the mind and body can reduce stress levels. Nurses who practice progressive muscle relaxation can identify when they are becoming tense and distress their bodies. The practice may help reduce the negative effects of the pandemic. The researchers also found that nurses with a higher stress level were more likely to report poor quality sleep. They hope to further evaluate the effectiveness of relaxation techniques to reduce stress levels in nursing. Hospitals and nursing facilities are experimenting with various ways to relieve stress and improve employee satisfaction. Some of these methods include creating serenity rooms with soft lighting, comfortable chairs, relaxing music, and pleasing artwork. Creating a calming environment for staff can lead to improved health, increased job satisfaction, and even better care. Hospitals can create a stress reduction environment in break rooms by installing such a station. Yoga. A recent study of nurses exposed to high levels of stress found that participants who practiced yoga regularly reported a reduction in work-related stress. The researchers compared participants' scores on the Pittsburgh Quality Index and a questionnaire measuring work-related stress and sleep. They found that both measures were significantly improved when participants practiced yoga, even when they weren't in an intensive care unit. Yoga is a complementary treatment for stress that improves health by reducing anxiety, depression, and back pain. Recent studies of nurses have shown that yoga has beneficial effects on nurses' mental health and physical well-being, and it also helps nurses develop self-care. While previous studies have focused on nurse-specific outcomes, the results of this study show promising results. Yoga can promote emotional resilience, reduce stress, and increase clinical decision-making. Despite the promising effects of yoga, further research is needed to determine the best way to implement it into a nursing practice. Several interventions have been implemented to help healthcare workers reduce their stress and improve their overall well-being. These interventions include rescheduling shifts and increasing the frequency and duration of breaks. In addition to yoga, the study of healthcare workers also revealed that meditative practices such as mindfulness and breathing exercises improve psychophysical well-being. The results showed that nurses who practiced yoga showed significantly fewer symptoms of physical exhaustion and a higher level of self-care and self-awareness. The meditative and physical components of yoga are especially beneficial for busy nurse moms. The techniques of yoga can improve concentration, create inner peace, and cultivate compassion. All of these benefits are great for the health and well-being of nurses. You can even incorporate a daily yoga practice into your schedule if you're a busy nurse. You'll be glad you did. It might even make a difference in the quality of your work. Meditation. The benefits of meditation for nurses are numerous. The practice helps nurses relax and manage their stress levels. In addition to relaxing the mind, many meditation techniques can be performed anywhere, even at work. Smartphone applications make it easy for nurses to meditate without the distraction of their office or home. Meditation helps to calm the mind and clear away unimportant information, thus calming the jumbled stream of consciousness. In addition to helping nurses deal with the stresses of their jobs, it also helps them reduce depression and insomnia. Mindfulness meditation teaches nurses to pay attention to the present moment. This is crucial for nurses, who must be constantly on their toes. They need to remain focused and grounded in order to be able to respond appropriately to stressful situations. Through meditation, nurses can learn how to cultivate their inner thoughts and develop self-compassion. This is key to managing stress in today's complex healthcare environment. Further research into the benefits of meditation for nurses is needed to prove its effectiveness in this field. This study used a 204-bed community hospital as an example. Its holistic care approach has been growing in the last couple of years. It includes a policy-guided holistic care council, a shared governance structure, aromatherapy, and massage chairs in the nursing break rooms. The researchers believe that these practices are beneficial for nurses, especially those who work in an environment of high stress and high anxiety. They also note that this technique may help reduce the risk of chronic diseases like heart disease and high blood pressure. When you need help, talk to your manager about your concerns and the ways in which you can alleviate your stress. Nurses who have a high level of stress should seek support from their supervisor or colleagues, and they should feel free to share their feelings with others. These people are the ones who can help them make decisions that will help them feel more positive and reduce their overall stress. So, why wait any longer to try meditation for stress management? Talking to coworkers. Nurses can often find it difficult to deal with the stresses of the job. However, talking with coworkers can help ease this burden. It is helpful to try to understand the root cause of the stress, as it will allow you to offer the most practical solutions and tactics. The most common causes of stress include too much work, uncertainty about how to succeed, and interpersonal conflicts. If you can identify the source of the stress, you can help your coworker find practical solutions and tactics to reduce the effects of the stressful event. Nursing stress is caused by a variety of factors. For example, conflict with coworkers and management can increase anxiety levels. Taking notice of the triggers will allow you to prepare for them and lessen their effect on your health. For example, you may find that you have a hard day at work because of poor staffing. In that case, the solution may lie in improving the communication between the manager and the staff. In addition to talking to colleagues, nurses can discuss their own stress levels and their own health. In addition, they should share their successes with their coworkers and be willing to open up about their experiences of stress. Talking to coworkers can be extremely helpful in reducing stress and making the work environment a healthier place for nurses. By being transparent and open with colleagues, nurses can ensure that they have an effective stress management system. The Lazarus and Folkman theory focuses on two types of coping strategies for nurses. This model identifies 3 general scenarios and a list of possible stressors. These patterns of coping result in the gray outcome, which is the prevailing response of nurses to a stressful situation. It is important to note that nurses adopt a variety of strategies for managing stress, including those based on self-reliance, situational control, and spiritual coping. Creating a safe environment. Nurses in high-stress work environments face a high risk of developing depression and anxiety. Moreover, they may experience ongoing feelings of lethargy, fatigue, and depression. Stress management strategies can help nurses improve their overall health and maintain vitality in their roles. Nurse leaders and educators can also play a role in stress management for nurses by providing resources and information on self-care strategies. Following are some practical tips to support nurse stress management. Creating a safe environment for nurse stress management requires a focus on clinician well-being. Stress can affect patient safety and prevent employees from delivering innovative and safe care, in addition to increasing the risk of errors. It also inhibits open communication and impedes communication among workers who know the system best. Therefore, hospitals must recognize the impact of workplace stress on their workforce to improve patient care. And in order to reduce the risk of errors and other factors related to patient care, they should expand the availability of confidential mental health services. The first step in stress management for nurses is understanding the importance of self-care and accepting the fact that they need to protect their own health to perform their jobs well. Creating a safe environment for nurses will enable them to reap the benefits of their profession, a broader perspective on life, and the ability to help others in times of crisis, increased tolerance and gratitude for others, and a greater appreciation for family and friends. Healthcare institutions can play a role in promoting healthy living environments for nurses. By encouraging nurses to practice mindfulness, healthcare organizations can help them develop healthy lifestyle patterns and combat stressful working environments. In addition to developing a safe environment for nurses, agencies can also promote stress management programs for employees. For example, they can offer aromatherapy and support rounds to reduce workplace stress. A quiet room with candles and herbal tea is also an excellent resource. Social support. Building a strong social network is essential for reducing the effects of stress on your physical and psychological health. Research has shown that social support can mitigate genetic vulnerability and confer resilience to stress. It may affect the HPA and noradrenergic systems, and may influence central oxytocin pathways. However, more research is needed to find specific interventions to improve social support. In the meantime, you can start making friends and improve relationships to increase the amount of social support you have in your life. When establishing a social network for stress management, make sure it is a place where you feel comfortable. You should feel comfortable with the beliefs, practices, and expectations of the people with whom you associate. You should not be expected to agree with every individual in the group. It should be a place where you feel accepted, peaceful, and energized. However, you should avoid being around people who are negative or coercive. Having a close network of people is a lifesaver. Studies have shown that individuals with a rich social network are less likely to engage in risky behaviors, avoid negative appraisals, and adhere to treatment. In addition, individuals with a rich social network are believed to engage in active coping mechanisms. Among cardiac patients, high levels of social support are associated with lower rates of depression, and it may even help patients recover more quickly from cardiovascular events. The study also revealed that individuals with a larger network of support and mentors are more likely to successfully manage their stress. However, the study's findings do not support a causal relationship between social support and depressive symptoms. While this study does not support the theory of social support as a treatment for depression, it does support the concept of social buffering and the stabilizing or regulatory effect of social support on the HPA axis. Exercise. There are many benefits of exercise for stress management. Not only does exercise decrease stress, but it is also good for your health. You will notice a decrease in overall stress response when you exercise, as well as a boost in mental clarity and a healthy body. There are also many additional benefits of exercise, such as improved brain function. Here are some of the most common benefits of exercise. You'll notice a dramatic improvement in your health in no time. Physical activity is a proven stress buster. People who enjoy physical activity will stick with it for the long term. Generally, exercise for stress management involves doing a certain activity more than once a week, with a break-in period of around 5 to 6 sessions. Exercises should focus on body movement, muscular endurance, agility, coordination, and accuracy. General fitness includes endurance, strength, balance, flexibility, and agility. Physical activity improves your overall self-esteem. Physical activity also improves your body's ability to use oxygen. It can also help you shed body fat, a common problem among overweight people. Exercise is also a useful part of a weight loss program. However, exercise will not solve the root cause of your stress, such as an impending deadline. You might be better off finding a new hobby that will help you relax and distress, or spending more time with family and friends. In addition to its physical benefits, exercise for stress management also improves your mental well-being. Whether you're a savvy weightlifter or a regular attendee of a high-intensity interval training class, there's something for everyone. Try taking a walk around your neighborhood to reduce your stress level. This will improve your mood and give you a renewed energy. Even a simple brisk walk will increase your energy levels, and you'll feel healthier afterward.